Hello, everyone. Welcome in to our clinical confidence round. I see some people already in here. Let me know if you can hear me okay, you can see me okay. Give me a thumbs up or drop it in the chat so I know who is in here. And we are going to get right into our special case for today. This is going to be a really exciting one because I have a GI map. I know we took a look at a GI map last week, but this one in particular I thought was very interesting because it has a lot of virulence factors within H. pylori along with a lot of parasites. And so we're going to be talking about what to do to support that patient when there is multiple different things that we really need to support when it comes to this person. So if you're new with me, welcome in. Hello, my name is Drue, one of the clinical advisors. I'm also a registered nurse and a functional medicine practitioner. I've been doing this for about 3 years, and I absolutely just love teaching it. And today, what this class is for is essentially just walking you through how to apply these functional medicine principles when it comes to your patients. So, we do this when it comes to being in our program. So definitely hop in if you're a part of the program into our clinical classes. Essentially, we have nutrition classes, lab consult classes where we do this 4 days out of the week, and we can take a look at your patients that you have and help you develop a protocol from there as well. And also, we definitely love to hear any feedback or any ways that we can make this a lot more valuable to you. Please let us know. We're just definitely open to how we can continue to grow and get better. Then this is like the 4th or 5th week of me doing this, so we'll definitely really expand it from there. So with that being said, I'm going to go ahead and introduce you to our patient here. Let me just move some things around. And yeah, then we'll take a look at the labs. Give me a second because I do have to quickly make sure that these labs are all good to go here. Give me a second. But yeah, I'd love to hear in the chat. I know, let's see, I think it was, Jessica, you're with us. I hope you're doing well today. And I believe I would love to see, I know that we've done GI maps the last couple of days or the last couple of weeks. If you'd like to learn about any of the other labs, please let me know if you're interested in doing like a Dutch test or even just some serum labs, whatever would be most helpful for you in order to walk through, especially and maybe even a test that you've never even seen before. We could definitely go over that as well. All right, so I am all ready to go. I'm going to go ahead and share my screen, and then we will get going. For those of you who might be new, I'd love to hear about what if you've ran a GI map before as well. I'd love to hear about that. If that's something that you have run, how familiar are you with the GI map? It's one of my favorite tests. I'm very familiar with it, and I absolutely love this test. So great. Let's go ahead and get started here. We have our GI map. I'm also going to read you some information about the patient as well. So that way we have a little bit of background. And I'll also ask you questions. No pressure. I'd love to see some of your responses in the chat. But if you are in a place where you're not able to type in there, no worries. But what we'll do is go through this patient's case, and then we will go from there. Jessica, Dutch and serum labs, blood sugar and cortisol. Wonderful. I will plan on doing that for next week. That's a great idea. I love the Dutch test, and also those serum labs would be very, very helpful, especially to walk through the different connections between serum labs and also when we have those advanced test results as well. All right, let's get into this patient's case. We definitely have a lot of stuff going on when it comes to this first page. But I really want to introduce you when it comes to the patients, what type of symptoms that she is having. So this is a 42-year-old female, and something that I do have a question for you all. Oh, wonderful. Running a GI map through right now for the first time. Wonderful. That's great. Yeah, the GI map is a very helpful, the LabDX is a very helpful tool, especially when it comes to identifying and putting together some recommendations for the GI map. I love it. But yeah, so right off the bat, without even going into patients' details and information, who all could tell me what type of symptoms can a person experience if their H. pylori is high? I'd be very curious to know who might be able to get this, because there's certain types of things to look out for and to really pair with this with what we're seeing on the labs, of course, because we want to take a look at the lab, but we also really want to make sure it fits with the clinical picture that we're seeing. So yeah, if you are thinking or you're about to type in the chat, H. pylori, also, where does H. pylori sit? Where does it live in the body, in the digestive system? Where is this being tested when it comes to this H. pylori right here? If you're thinking in the stomach, you are correct. H. pylori is a bacteria. It lives in the stomach, and it also has these virulence factors. If you are not familiar with these virulence factors, they're essentially, Jessica, great stomach pain, gastritis. You're 100% right. Those are definite symptoms that people can experience from having H. pylori present. Great job. Lives in the stomach, as we said. And also, we do have these virulence factors. So whenever we have an H. pylori that's high, but then we also have these virulence factors that are positive, what can happen is that essentially the different strains of the H. pylori, it can put people at risk for other types of inflammation pathways, stomach cancers, and also ulcers. And so if they're having that stomach pain, if they're having gastritis, or if they've had a previous diagnosis of it, but they didn't check for H. pylori, it's a really great test to run, especially if somebody has like chronic gastric reflux. This is great, a really good test to run, because we could see what might be contributing to those person's symptoms, and also potentially protect them from something a little bit worse down the line. Let's say if they were to develop some other gastritis or stomach ulcers, and it could impact, of course, our absorption and our digestion, because of course this is in the stomach. So yeah, those are all great things to think about, especially when it comes to seeing this H. pylori being positive. So I wanted to ask you that before we go into the clinical picture of what we're experiencing for this patient. So the primary concerns for this person is bloating, and that was all that this practitioner put when it comes to this test. But she does have a significant GI health history. So she had a food poisoning episode and history of UTI, treated with antibiotics, onset of heavy menstrual bleeding in the last 2 years, high work stress, bloating, digestive discomfort, lack of restorative sleep. She has sleep disruptions. She's waking up 2 o'clock to 3 a.m., restless legs, teeth grinding, possible sleep apnea. And also she has a lot of body weight and is a little harder for this patient to lose weight. So as we're seeing here, there's a couple red flags that we should be thinking about, considering that we also have this GI map test. We have had food poisoning, so it's a red flag that can alter the microbiome of the gut. And she's also been treated with antibiotics in the past as well. I'm not sure how much antibiotics, the type of antibiotics, but you know that any type of antibiotic use is going to change the environment within the gut as well. So those are already some of our red flags that we're experiencing, of course, specifically tied to this gastrointestinal test. And also, of course, like the bloating and the digestive discomfort. She's also she's waking up in the middle of the night. And we're going to take a look at the rest of this test here as we start to go through it. But those sleep disruptions, first thing we want to think about is blood sugar levels. We want to make sure the blood sugar is stabilizing in the night and not being like hypoglycemic at like 2 to 3 a.m. But also a big part of that is parasites. So Parasites can also cause those types of issues, especially around the full moon. That's, I guess, when they're a little bit more active. So, with that being said, we have this first page, and we pointed out this H. pylori, and we also can take a look at the other commensal bacteria. So these are our good guys, of course. We really want to make sure that we have a diversity, of course. And the way that I explain this to my patients, and it really helps connect the dots for them, is that we are providing these good gut bacteria a home, and in return, they help regulate and keep the environment within our gut very safe. So they help with producing what's called short chain fatty acids, which is our butyrate, propionate, succinate as well. Those are like the three main short chain fatty acids that these are being produced, and really helps significantly lower inflammation. So that's one of the biggest things that we're looking at right here. And we do see that her commensal balance is overall decent. We do have a higher Akkermansia level that is high, and Akkermansia specifically, having it high is an indication of leaky gut. And that's because Akkermansia, it lives in the mucous membrane layer. It's a mucus degrader. And so when we have a lot of mucus when we have a lot of mucus degraders, that means it's degrading all the mucus and the environment that the good gut bacteria are living in. And it's causing a little bit more exposure when it comes to the gastrointestinal cells. Because if you think of like a layered cake, the top layer, the frosting, is going to be like that mucous membrane layer. That's where all the bacteria are thriving. And then we have like that first layer of cake. And so that's like our intestinal cells. And so if we have a lot of Akkermansia, just think about the frosting being completely gone, or maybe it's very splotchy and we're just looking at the cake. And of course, if that's our gut, then that's going to be it's going to cause a lot of inflammation and potentially a lot of issues at that gut level. All right, so that's the first page. And then we also have a little bit of phyla here. These phyla are basically the two dominant families of bacteria in the gut. We have a little bit of overgrowth right here with the Firmicutes, but then the Bacteroidetes is okay. So overall, what I would call this is like dysbiosis. We have just imbalance. Dysbiosis essentially just means imbalance. And so it's our job to bring, of course, back balance into the gut. And we'll talk about a treatment plan and just like a good cadence to support this patient. But the biggest red flag that we're seeing is this H. pylori with these virulence factors. This is going to be the priority number one. All right, going down to the second page, and of course, great job, everybody in the chat. Bloating, belching, stomach, and duodenum. Yeah, that's something, Sandra, that I didn't mention that I'm really glad that you brought up, is that H. pylori, if you have it, then the digestion is going to be significantly compromised, as well as absorption. We think about, what do we absorb in the stomach? Calcium, iron, a lot of B12 that happens in the stomach. And so if some people, I know we don't have serum levels on this, but I'd be very curious about how this is affecting, that H. pylori is affecting those serum levels. So that way we can get them the support that they need. Typically, a lot of my protocols always includes a multivitamin that's methylated, just to make sure that everybody is getting their B vitamins, so that way their body can actually run the processes that it needs to process, right? That's the reason why we eat food, so that way we can make sure that our detoxification pathways can be run effectively, our mitochondria for energy. We have our making sure that our neurotransmitters, so that way we can think and be very focused. So, of course, food is very important, and therefore our digestion is really important. So supporting that stomach level is going to be very important when it comes to that treatment protocol. Okay, so let's see. On this next page, we do see some streptococcus. We also have citrobacter right there. And this next page, if you're not familiar with the GI map, this is our opportunistic microbes. And I always like to think of this as a forest, right? It's like the Amazon rainforest. So I've never seen a perfect quote unquote GI map where all of this is completely negative. And honestly, if I did see that, I'd be a little concerned, because of course, with any rainforest, there's going to be some weeds. There's going to be some, bad plants that we don't really want to have there, some vines. And that's the same thing with these bacteria, because let's say if the vines or the weeds get overgrown in the Amazon rainforest, then it's going to take out or it'd be a little bit harder for the other healthy plants to grow. So that's what we are looking at when it comes to this. Of course, there's going to be some that are present, but we really want to take a look at the high ones, especially when it's significantly higher than this reference range, like the Citrobacter. This is E to the 9, and then the reference range is E to the 6. So with that being said, of course, taking a look at the more that you do this, the more that you'll know the bacteria and get to know them a little bit better. But if you're just starting out, highly recommend looking at like the GI Map Interpretive Guide, so you could find out some information about specific markers or the specific bacteria. Because this one in particular is very highly inflammatory, and it could also contribute to those systemic neurological symptoms like brain fog. It also causes a lot of bloating, just because that is releasing those lipopolysaccharides, which is what that gram-negative bacteria does, and it really hinders the environment within the gut. So we're looking at that for that next page. Going on to this, the third page this is the one I really was excited to show you all this week, is because look at all these parasites. And I think this was my first test that I saw where all of these parasites are present and also very, very high. This is somebody who, again, they had food poisoning, and they also are under a lot of stress. Those are huge things to consider when it comes to like a lifestyle, but also when it comes to a treatment plan. Because I also think this is a really great test to explain and compare the differences between what functional medicine and is really, really able to capably support this person with, but then also when to lean on antibiotics and also pull in that Western medicine if you're a prescriber, or if you want to like really have that multidisciplinary team as support. This is a really important case to bring in that antibiotic therapy, especially considering all of the parasites that we're seeing here. Look at this person's immune response. The immune system is really low. And we also have, of course, this H. pylori present. These are like big red flags that I'm seeing. And it doesn't mean that functionally we're not able to support this patient, but it does mean that we really need to make sure to address the main dysfunction here to pull in some of those heavy hitters while we're supporting in the meantime. So with that being said, let me actually pull over the not this one. So this is the LabGX. Give me a second. Sorry. The treatment plan for this patient, because this is going to require definitely some extra support, especially since there is, again, that H. pylori and the parasites that are present. So just curious, I know we have 10 minutes left, but I'd love to hear what you guys say in the chat. And I think that there's a little bit of a delay, so I'll wait for a second while I pull it up. But where would you start with this patient first? Let's already rule out that we're going to do antibiotics or that triple or the quadru therapy for this H. pylori. But what is another great supplement that we can include to help support just like the environment of the gut, and also to help support the healing of the gut itself? I know we haven't really gotten into any products specifically, and I do want to mention, as we're talking about different products, I'm not affiliated with any of the supplement companies. I just always like to share about what's worked for me, what I love the best, and also for my patients. And we'll also talk about like single ingredient by not like saying like any certain ones, because this is not sponsored by any means. I just share about what I like to use for my patients and also for myself. But Jessica, yes, DGL marshmallow root for healing the lining. Those are wonderful wonderful recommendations, especially because we have so many of these virulence factors. I also want to throw in some like zinc carnosine is one of my favorites, as well as L-glutamine. Both of those can be very, very helpful when it comes to not only the immune response because of the zinc, but also the L-glutamine is very important to help solidify the tight junctions. So remember we had the akromansia. There is a protein called zonulin that regulates the permeability of the gut, of the intestinal cells. And so when zonulin might be really high, which I know we don't have a zonulin level on this test, then that permeability is going to be is going to be a lot more open. And so essentially what L-glutamine does is a protein that helps mend the cells back together, especially because we have akromansia present and it's high. Not just present, but it is high. And we want to make sure that we're supporting this patient if they do have leaky gut. So that'll be big. Great recommendations. I love those. Something else that we really also want to consider is, I'm going to go down to some of my other notes here. Something that's going to be very important for her as well is something to support her immune response. Some IgGI Shield, that's a Designs for Health brand, or one of my favorites is SBI Protect. Essentially, those are going to be immune globulins because this person is fighting off a lot of things, right? Like we have the parasites, we have the Citrobacter, and we also have the H. pylori that's present. And so adding in some immune support is going to be very helpful when it comes to helping the body naturally fight these things off. But then also it won't, when somebody is going to be starting those antibiotics and starting to kind of kill things off and bacteria starting to die off, then the body is supported when it comes to that immune response. And highly, highly recommend when it comes to supporting that person, especially in the first phase. So now let's talk about some of those phases and what some of those goals will look like. And I know we talked a lot about the H. pylori, the parasites, those are going to be the biggest ones, but let's kind of make it a little bit more tangible of how I would approach this patient. So I really like to lead when it comes to symptoms instead of like a very, a very concrete time of what phase 1, phase 2, phase 3, phase 4 would look like in a protocol. I really like to have my body, my patient's body be the guide when it comes to whether we need to continue on or do a little bit more gut healing versus go into maybe like a kill protocol. So with that being said, some big key like KPIs or key performance indicators or symptom relief that you would want to expect is something that you can really communicate with your patient to let them know that, hey, it's not going to take like 3 months to heal this, but we're really going to utilize that language and understanding from your body to help us know when to progress. So that first type of phase 1, some of the goals that we're looking for is just to really decrease a lot of that bloating and post-meal discomfort within that first 4 weeks. We want to do daily bowel movements, reducing the gas and some of those triggers that we can have a little bit of a handle on when it comes to diet and nutrition. We really want to start initiating that mucosal repair like Jessica had in the chat, DGL, marshmallow root, great options, zinc carnosine, L-glutamine, throw those guys in there as well. And also that immune support, that the immune globulins, whether from what other supplement that you really want to have in there. So that way we can really raise that tolerance to clearance work. And this, I do want to emphasize, this can all happen before we get into any antibiotics. So from the time that this patient comes to you, we read the results, you send the results to the PCP or a GI, or if you're a prescriber yourself, it's going to be a lapse of time to really get this person on some antibiotic therapy. So in the meantime, we're working on rebuilding, we're working on stabilizing. And so then we can really start to get into the next phase, which is going to be more of that targeted clearance with the dysbiosis. We can do more of that antibiotic H. pylori eradication right there. And also keeping in mind that those protozoas. And then the next phase is going to be re-inoculating and rebalancing. So we can really build a lot of microbiome diversity. Of course, these gut bacteria, they're going to depend on fibers. And so we really want to diversify the diet. I'm not really sure what this person's diet looks like. I can take a look real quick. I have the intake form. But if this person's diet, let's say, is, they're grazing, or maybe they're just having a little bit of snacks here and there, we definitely need to support the diet by diversifying soluble fibers, insoluble fibers, and maybe even a really good probiotic. So that way we're able to bring back that balance in the gut, and all of that. So that essentially is okay. So yeah, this person I didn't get a lot of information on this person's diet, but that's going to be the biggest thing when it comes to supporting this person. Great to know, Sandra. Matula tea helps with H. pylori. Well, that would be a really great intervention while we're really supporting them in the meantime, with the eradication, to include that on, especially when it's really supportive to heal the stomach lining, and we bring a lot more of those healing things in, rather than like, okay, this is going to really shake things off and like push detox or try to push a kill protocol when the gut, right, is a little bit too stressed out right now. Yeah, amazing. All you guys are doing have a lot of great recommendations here, but let me stop sharing my screen here. Great options. Sulforaphane chloride, vitamin U. Okay, great. I'm not really sure to methylmethionine. Okay, yeah, methylmethionine. Wonderful. Yeah, those are great. Bone broth, of course, is really good, considering if they don't have like any histamine issues, but those are all fantastic options to help bring a lot more support for the gut. Of course, we want to do the adding in more protein. And I really like to, especially if the gut is very inflamed and really on fire, I like to do single ingredient ones, not throwing a whole bunch of supplements at them, but like single ingredient things. Zinc carnosine is one of the most studied to really provide that immune support, but also that healing for the gut. It's definitely essential for that. All right, everyone. Well, it has been such a pleasure to talk with you all on this clinical confidence rounds. I do want to remind you all, if you're not in the program, we do this 4 days out of the week, and I am in a lot of our clinical classes. And I absolutely just love what we're doing here, because of course, we take a look at the tests and they're not, everybody's very individualized, right? And so if you're interested in finding this out or having support when it comes to your patients, definitely want you to check out our program here. And yeah, we'll see you guys next week. We'll do a Dutch and serum blood labs. We'll take a look at some blood sugar and cholesterol. Maybe we'll do that, and then also a Dutch for the following week, but we'll figure it out. But we'll be back next week. Definitely hop in, share with your friends. Please subscribe to our channel so that you'll never miss one of our clinical confidence rounds. And yeah, thank you all for all the engagement. I love to talk with you all as well. So if you have any questions or any further recommendations about how to make this valuable for you, please do not hesitate to let us know and comment down below. All right, everyone. Bye-bye. Thank you so much.